Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And I always talk to you about trying to make sure that you have good health, and we try to give you information about your health care. And I always believe that if you have a good, healthy community, we're going to also be healthy. So this is a show that's dedicated to the health care of the community, and it relates to the animal-assisted therapy program and really the other programs at the Humane Society of Broward County. It's the animal-assisted program, as I said, Wags and Tails, Canines for Community Resilience. And in front of me is one of our volunteers from, when I say, I consider myself a member of your venue, so I said one of our Humane Society of Broward County. Rosemary Blumberg, welcome, Rosemary. How are you?
I'm fine, thank you.
Would you tell us who we have here?
This is Toby. He's a little bit antsy today.
It's all right.
But he's
nervous.
Yes, he's a little nervous. And he's part of the team. We are part of the volunteer program at the Humane Society. And we are participating in the Wags and Tail program. We now go to a nursing home, and he goes to a behavioral health center once a week.
That's great. And the preeminent manager director of our animal-assisted therapy program, someone that, this is your sixth time, Marni, that you've been here, which means that either I'm getting older or you're getting younger. So you're getting younger.
I'd like to get younger, yes.
Yes. This is Marni Bellavia. Marni is like I said, the manager of the Humane Society of Broward County's Animal-Assisted Therapy Program. Welcome, Marni.
Thanks for having us back.
And look who I have on you have on your lap, my old friend. Introduce to you, my old friend.
This is Karma. Karma is an 8-year-old mini Australian Shepherd, and she was adopted from the Humane Society.
That's the best. Adoption is the way to go. Well, let's talk about, Marni, let's talk about just the elements of not only your program, but the broad spectrum of services that comes out of the magnificent Humane Society of Broward County, which is located on Griffin Road, right near the railroad track, sort of, in that beautiful white building, which has been redone over the last 4 to 5 years. Talk about it.
So the Humane Society of Broward County, obviously, as you know, we provide aid to homeless animals in the community, and we adopt out animals to loving homes. We have a foster care program where if animals come in that are too young to be adopted, we have volunteers that will foster them until they're old enough to receive their loving homes. We have a full medical clinic, veterinary clinic, for all of our animals at the Humane Society as well. We have a pet boutique. We have a full education department, so we work with pretty much all different organizations in the community, educating kids on pet care and responsibility and bite prevention programs. We work in the schools. We work with clubs like the Girl Scouts and the Boy Scouts and the Eagle Scouts. And then we have our animal-assisted therapy program where we work with hospitals and different types of senior centers, and we work with schools and libraries as well. And then we have a development department where we do all of our fundraising, our annual walk for the animals, and things of that nature to raise money for the Humane Society.
Well, Ms. Rosemary, if I can call you Rosemary. Rosemary Blumberg, I know that you and your wonderful dog here that's sitting before you, Toby, you have a specialty situation where you provide services in certain venues. So explain exactly what you do.
Well, we go to the Behavioral Health Center, which is just such a wonderful feeling that I always get from the response that I get from the patients and from staff. The caregivers, they'll say, oh, here comes brown sugar, here comes Toby. The patients will say, this is the first time I smiled all day. It's just such a wonderful reception that we do get, so it's very rewarding. And he goes to different units. We have patients that are recovering from an addiction. We have children. We have adults. And he'll visit with them all on Thursdays. We actually, in the afternoon, we have herbal tea with the patients in the detox unit. So it's tea and Toby on Thursday afternoon. which is always a wonderful thing. And he's wearing a little necklace that one of the patients made him, which we keep on because it's just such a nice reminder of the good feeling that I get when I go. And it's just nice to bring smiles to everyone.
Marni, why don't we tell the people all of the wonderful work that you've been doing, not only at Margaret Stone and Douglas, but also at the elementary school across the street, which I think, in a way, is probably not only equally, but maybe more important. So why don't you talk a bit about that?
Sure. So after the shooting at Marjorie Stoneman Douglas, I created a program called Canines for Community Resilience. And what that program is, it's specially trained dogs and their owners that are trained to work in traumatic situations or critical incidents. The dogs are specially trained to be able to cope and manage with varying personalities of people that have a range of emotions, obviously, that are in critical conditions. And the handlers are educated in psychological first aid as well as pet first aid and human first aid. So they're able to work with people and help them through their grief process, help them with their stress reduction, help them with feeling hopeful in a very hopeless situation. And what we did was we sent out 20 of our therapy teams that had this specialized training to work one-on-one or in groups with the students, both at Marjorie Stoneman Douglas High School and at the surrounding schools, the elementary schools and the middle schools, as well as in the community at large. And what we found was that, you know, for most of these, all of these kids that we visited, they found a lot of comfort in having the dogs there. A lot of stress was reduced. You know, it didn't take away what happened, but it certainly helped them in being able to start to put the pieces back together again with their lives. Plus, they were working with counselors and school counselors and grief counselors. So having the aid of the dogs there to help them with their comfort level was definitely a plus because it was a very traumatic situation. And then we went on to expand the program where we are working now with first responders in different in the county of Broward, but in different cities. So we work directly with like the city of Miramar Fire Rescue. We have a partnership with Broward Sheriff's Office with the regional communication centers. So we visit the 911 operators and dispatch callers. And we provide stress relief for them too, because you can imagine that that's a super stressful job as well. And we work with police and fire, and it's a program where we have realized that the impact that is on the community from a critical incident perspective, those people really need to have a lot of stress relief. They need to be able to relieve their grief and be able to talk to a non-judgmental entity, hence the dogs, and be able to just feel like they're being comforted and relieving some of that stress. And, dogs help to provide that. They also help to provide resilience, more hopeful society. Just petting a dog helps reduce blood pressure and anxiety. So all of those things are really remarkable, and the feedback has been tremendous off of the program. It's received national coverage as to how wonderful it is, and many other places in the world, I think, now are starting to utilize dogs in a much broader spectrum because of that.
Rosemary, you work in that area, often in what I would call the harm to one's psyche and brain, in essence. Talk a bit about that.
Well, just to see how that people respond to Toby and how he just goes up to them and he seems to know who needs him, and he'll sit next to them and they'll pet him, and it's just such a beautiful thing to see, and to see how their stress levels are reduced and their cortisol levels are reduced, and just the sense of well-being. You can see the smile on their face, and I think I said it before, it's very rewarding, but it's just wonderful to be able to bring that to people in a facility.
Are you involved with Wags and Tails?
I am. We do, once a month we go to the Southwest Regional Library and children read to Toby. And I think it was just a couple of months ago, someone brought their book back that they had read to him the month before with a bookmark in, so that they would continue the story where they had left off, so Toby wouldn't miss any of it, which I thought was just very clever.
Well, Miss Bellavia, I ask you about this each time you come on because it's I think, such a poignant and direct story with reference to children. You talk about the Wags and Tails program and how, and I'll let you relate to it, but I'll point you to the subject. You always talk about the child who has very severe eye vision issues and wearing very large glasses and wants to stay hidden. Mm-hmm. Tell the story.
So the premise behind the Wags and Tails reading program, it's a reading motivation program. So we have a volunteer like Rosemary who brings her certified dog in, and the child reads one-on-one with the dog and the volunteer. And the thought behind it is that we want to encourage children to read out loud. We want to encourage literacy, articulation of feelings, and we want it to be in a non-judgmental environment, and we want the child to feel comfortable while they're reading. So by virtue of having the therapy dog there, we take away a lot of the stigmatism of feeling inadequate or feeling like they may not be reading at the right level. They may be in classroom where they get called upon in front of all their peers and they have to read out loud, and maybe they're not the best reader. Maybe they do wear glasses. Maybe they stutter, and it's embarrassing for the child. And then they don't want to read, they don't want to learn, they don't want to continue their, education. And plus, as much as we don't really want to think it is, because we like to think the best in people, there's a lot of bullying that goes on in schools, and kids make fun of kids if they wear braces or glasses. Or just a couple of weeks ago, Karma was working with a child that had a hearing aid. The child was only in the second grade, and he had mentioned that he, oftentimes feels embarrassed because, even though it's in his ear, the kids can see it, and they kind of laugh at him like, what are you wearing? What's in your ear? And he felt so much better being able to spend that time with Karma and get through his chapter book, where he didn't feel the pressure of, having the other kids kind of making fun of him. So, by virtue of this program, we kind of eliminate all of that. And the kids come back and they feel, a lot better about themselves. They feel a lot better about reading out loud. They're empowered, and they're in a different frame of mind when they're done. They feel a lot better.
That's good. And Rosemary, you see some of this, I guess, in
yes.
the venues that you're involved with.
Yes, and definitely with the children. Just they sit in a circle, and he just goes to sit, to see everyone, and he really does bring a smile to their face. And
it gives I remember, again, I'm trying to think back at some of the words that this nice person has thrown at me over the last 10 years. But it gives the children a sense of stability.
It does. And also, children don't always know how to react around dogs or how to interact with dogs. So that's one of the things we also try to let them know, that you can't come up to a dog that you don't know, and you have to check with the owner, and you have to really be careful because dogs may not be friendly. So you have to know. But a dog in a hospital is usually there because they are friendly. But just to know how to pet them, I always say pet them from their collar to their tail. If I came at you with my hand, you might be afraid. So you don't want to put your hand right in the dog's face. So there's different education that we will provide for the children as well. And
you see so many, of course, again, I recently walked through a cancer therapy center in a major hospital in South Florida. And I saw 4 or 5, I guess you could say, animal-assisted therapy dogs, or assisted therapy dogs. And I was totally amazed. The smiles come out.
The smiles.
The smiles.
And I think it makes people more social when they see a dog. They will come out of their room where maybe they wouldn't before. So It kind of gets them out into, to meet with other people as well.
Yeah, as I was going up the hallway, I saw a teenager and a younger person. I don't know how old this person was. And yet the animal, the therapy dog, was walking alongside. One was walking with a pole and the other one was in a wheelchair. And yet they were smiling.
They were smiling, which is...
I guess that's what it's all about, right?
It is what it's all about. And I am obviously a true believer in the unconditional love that dogs bring. I feel that they bring a level of love that we don't find in humans. We don't get that from each other. We love, but the unconditional love that they provide. They don't care what you look like. They don't care if you're sick. They don't care if you're healthy. They don't care if you eat right, if you don't eat right. They just bring love, pure divine love. That's all that animals do. They just bring that love to you. And, there are animals, and obviously therapy animals, but there are hundreds of thousands of companion animals that people have across the world that have innate abilities to love and to heal and to bring that energy to people that, like you said, that are sick and they are still smiling and they're still wanting to engage and they still want to be, involved. I just, I saw it the other day with Karma. I mean, obviously she's mine and maybe I'm a little bit biased, but we were in the pediatric hospital that we're partnered with, Broward Health, Coral Springs, and there was a 12-year-old child that was brought in through emergency from school. He had broken his wrist, and he was in the hospital, and he was terrified. And we met him at the ambulance, and Karma went on the stretcher with him, and they took him into the hospital. And just watching the interaction between her and the child, it was just the most beautiful thing. Here you have this child who's never been in a hospital before and is terrified, and what is meeting you at the ambulance doors but a therapy dog
beautiful.
That's then bringing, coming into the hospital with you. And he was, during all of his treatments and all the blood draws and the medical care, they had to reset his wrist. The dog was right there with him, and it was the most beautiful thing to watch. And that's, even though his parents were there, that's something that his parents, they were, it's okay, everything will be fine, take a deep breath. The dog brought a totally different level to that child where he felt he could be comforted. And he was, holding on to Karma, his arms were around her while they were doing all those procedures. And it's a beautiful thing. And I really believe that only animals bring that.
That is true. Well, I have a little bias. I'm on my fourth rescued animal, otherwise known as a dog, otherwise known as part of my family. You see it, it's not unconditional, it's really beyond that. It's unrequited love.
Yes.
It really is. They understand things. I think the wonderment of dogs, and in a sense, some cats as well. I mean, I just haven't had that much more than just, some time with cats in the house. But I would say animals themselves, domestic animals themselves, and maybe even wild animals, find a way to recognize the human spirit. And I don't mean to get too beyond the general knowledge, but they are very, very special. Talk to me and tell me how one has a dog and how they are trained to be a animal-assisted therapy dog.
So if somebody has a pet, to your point, because we do have various different types of animals in our therapy program,
Right.
and they want to volunteer, they can contact our volunteer department. Number is 954-266-6814. And basically what we're looking for animals that are friendly, animals that want to engage strangers is the biggest thing, because a lot of people have great animals and the animals are wonderful with them, but they don't necessarily want to interact with strangers. So therapy animals are animals that are actually soliciting attention or gravitating to people that they do not know. So they want that companionship of strangers. And they've got solid temperaments. They're good in multitude of situations. Obviously, we want them to be obedient. We want them to know their basic obedience, cues, sit and down and walk nicely on a leash. But it's, those are trainable. The temperament is the key. You need to have a loving, friendly animal that wants to be around strangers is really the most important thing. And then we would take them into our program and put them through the course.
That's good. And I would look out at the audience and let people know, not all of your pets are especially rescue dogs, because a lot of them have been abused. I've been through the story with you a number of times. I've had 3 rescue animals in my life that were terribly abused. It takes a long time. It takes a long time to gain the privilege of their faith in the person that they now live with. But sometimes you just can't get everything out of them. I mean, it happens. So it's very difficult. But I really think it would be a blessing that if you want your pet to be a therapy-assisted animal, then contact, as Marni said, what's the telephone number again?
954-266-6814.
The other thing that I do, which I never do during any of our shows, I never ask you to be supportive of any, in quotes, not-for-profit organization or otherwise, because after all, Nova Southeastern University is a not-for-profit university, and my responsibility is to ask for the university. But in this case, I've given my word to, God bless her soul, Marty Heisinger, to say that if you can slip in a little word about helping out at the Humane Society of Broward County, please do. So I'm going to tell you, if you want to send some monies to Humane Society of Broward County to take care of these pets, and not necessarily the people who are dealing with them, but please do. We're going to give you a telephone number to do that too. I want to thank all of you, the dogs particularly, and of course you, Marni, and you, Rosemary, thank you.
Thank you.
For the opportunity of showing our viewers, the humanity that's involved with the animals that are helping society feel a little safer, a little kinder, a little more gentle. And I believe very clearly that if you have the opportunity, folks, to make some child or somebody happy, visit the Humane Society of Broward or any one of the shelters that you might feel is appropriate, and adopt, These animals need the kindness of the humanity that you have within yourselves, and I'll guarantee you they'll give it back to you fivefold if you be kind to them. Is that true, Marni?
I agree. 100%.
That's what you taught me a long time ago?
I did. I did. Okay. At least I did a good job.
I hope you did. So before we close the show, I want to let Rosemary Blumberg, who lives in Plantation and is a long-time Broward Countyan, give us some words of advice and tell us about your beautiful dog again.
Well, Toby's 4 years old, and he just puts a smile on my face and on the patients that he visits. But I think more than that, I find it's the caretakers at hospitals and the nursing homes. And I think that's important because he makes them feel happy as well. And it's nice for everyone to just have that exposure to a therapy dog.
And they show, what I noticed when I see that, it makes them feel important.
It does.
Not that they are not, they
Right.
are obviously important, they do their work. But all of a sudden, it's sort of like an animal comes up to them and puts a smile on their face, and puts a badge on their chest or their whatever, and lets them know that, hey, you're doing a pretty good job.
Yeah, it is.
And sometimes it's very unappreciated. People don't. I think I've had a totally different perspective just in these last few years, especially after the shooting at the high school, of really what the first responders do, of what medical staff does, how hard and stressful their jobs are. So when we do go into these facilities, these hospitals and whatnot, it is important for us to stop by the medical staff or, the first responders or the caregivers and make sure that they're having some stress relief for themselves, because these are hard jobs that they're doing, saving lives every day, taking care of people every day, terminally ill people, children. Everything.
Yeah, it's tough. But they are They are the heroes and heroines of our society, and I have so much respect for our first responders and our protectors of our liberty and our safety, all of our police, and you know, the whole gamut. I could do a whole program on just superlatives for all their hard work.
Yep.
Well, I want to thank you both for being here, but particularly I want to thank Toby.
Toby.
And can I have my little dog over here?
I'd love to give her to
Karma?
you.
No, don't give her to me.
She's,
Just Karma.
She's all wiggly today.
Karma.
Gets it from Toby.
Come on. Come on up. Come on. Or Toby. Which
She's a
which
bit,
one do you
she's
want?
a bit on the wiggle side today.
It's all right. It's all right. Okay. All right. Okay. You okay? You okay? That's
You're wiggling too. Now you want to
Yeah,
go to
you're
Marni.
all right.
Yes.
You wanted to go back to Mama. Anyway, folks, I wanted to let you know. You see, I'm smiling. I want to let you know one more time that if you deem yourselves wanting to deal with Humane Society of Broward County, all you do is find them. And you say the comment is already kissing me because of what you do, hopefully.
Look at her
And Homer and I are old friends, and right, and you know that I love dogs, right? Thank you very much for allowing us to come into your homes again. Remember, this program is called Dateline Health. We come to you from Nova Southeastern University, and as Karma would say, kisses to all of you.
Aw.
Okay. My name is Fred Lippman. Until next time, see ya.